Hello, everyone, and welcome to the National Keratoconus Foundation. This is one of our series of webinars, and our topic for today is contact lens options for individuals with keratoconus, a very important and hot topic, which will be covered by our speaker this evening, Dr. Stephanie Wu. So I'm happy to introduce her. Dr. Wu was born and raised in Lake Havasu City, Arizona, graduated from the University of Arizona with a degree in biology, science education, and honors from the Southern California College of Optometry. She completed a cornea and contact lens residency at the University of Missouri in St. Louis. She has won so many awards, so I will only be able to tell you a few. She was the recipient of the Gas Permeable Lens Institute Award for Clinical Excellence and also the Griffin Award for Excellence in Vision Therapy. She's a fellow of the American Academy of Optometry and a fellow of the Scleral Lens Society. She is a past president of the Scleral Lens Education Society and an adjunct professor at Midwestern University. Dr. Wu owns the Contact Lens Institute of Nevada, a clinic dedicated entirely to custom contact lenses, and she is the founder of Wu University, a nonprofit company dedicated to providing high-quality education to eye care professionals. She was recently awarded the Gas Permeable Lens Practitioner of the Year in Education to Eye Care Professionals. So Dr. Wu is so well qualified to speak on this evening's topic, and I am so lucky to have her today. We actually crossed a bit in our education in Southern California, and it's been so amazing just to see all the wonderful things that Dr. Wu has accomplished in the last 13, 14 years. So just a few housekeeping items. We are happy to take questions this evening. Please type them in the chat box. They will be reviewed and we will get to questions midway in this session as well as at the end. So we'll save about 20 minutes at the end of this webinar. We look forward to learning tons about contact lenses. So I am going to turn it over to Dr. Wu.
Thanks, Dr. Chiu, and thanks so much to the National Keratoconus Foundation and Mary Pruden and Taylor Young for having me. This is a very, very important topic that is near and dear to my heart because about 70% of my entire practice is keratoconus patients, and specialty contact lenses are my passion so much that that is all I do now. So I got rid of all my primary care, and I don't sell glasses anymore, and I don't manage any other eye conditions besides ones that need specialty contacts. So I have developed and devoted an entire career to this exact topic. So I'm really excited to share with you some of the different contact lens options that are made for keratoconus patients. So I'm just briefly going to touch on keratoconus because I know every once in a while on these events, there'll be somebody that's newly diagnosed, or they maybe don't know a lot, or maybe they got confused from something that they read online. And so I just always want to start and just kind of make sure that everybody's on the same page as far as what keratoconus is, how it is progressive, what are the different treatment options, and what are some of the resources that you have available as a keratoconus patient. So this is how I explain keratoconus to my patients. So the front part of your eye is covered with a clear membrane, which is called the cornea. When I was a kid and I was using contact lenses myself, I would always think that I was putting the contact lens on the iris, the colored part of my eye. I didn't realize that there was actually another layer that I wasn't seeing. So whenever I am explaining keratoconus to patients, I like to show them photos like this or an eye model or have something in the office so they get a true understanding of what this disease is. So normally, the cornea is a spherical shape, kind of like a marble, but the shape of patients that have keratoconus is now more like a cone. So you can see in the different photos how the two eyeballs are very different. And even though you can't usually see it with the naked eye, so a normal person is not going to come up to you and say, oh my gosh, what's wrong with your eye? Or why is the shape of your eye like that? It doesn't get to that part until the keratoconus is incredibly advanced and severe. But for mild, moderate, and even early severe keratoconus patients, you would never be able to know just by looking at yourself in the mirror or by looking at somebody. It's really only detected by some of these instruments that special eye doctors have that will detect and diagnose keratoconus as early as we can. But the main thing that I always want to tell patients about is the reason that this is important is because as the cornea, that front part of the eye, steepens and becomes irregular in shape, that is what is causing the vision to become blurry, distorted. You may have problems with glare or double vision, things of that nature. And so I always think that it's really important to educate patients that the reason that keratoconus is so important to understand is that the shape of the eye being so irregular is now causing your eye to become very blurry and distorted and can get worse over time. I always like to also educate patients that keratoconus is a progressive condition. What this means is keratoconus will get worse and worse over time. So if you don't do anything, so if you were newly diagnosed with keratoconus and you don't do anything at all, your vision will continue to decline and you will be at risk for other eye events and other things that we'd want to avoid. So let's quickly talk about the treatment options, and then later we're going to talk about all of the contact lens options available to keratoconus patients. So the first thing that you think of right off the bat, when you have keratoconus, a lot of my patients want to know, can they just wear glasses? Well, the answer is yes. If your keratoconus is mild enough where the vision is not as distorted, you can definitely get away with glasses. But this is really only for very mild situations that you're going to be able to see very clearly. Now, almost all of my keratoconus patients have glasses, even if they have very advanced keratoconus where they really can't see through them. But the reason for that is because if there was some sort of emergency or you got an eye infection or you lost a contact lens, you always want to have at least something to kind of have in case that situation comes about. Contact lenses, which is what we're going to spend majority of our time on, are soft contact lenses. So those are the kinds of contacts that most of your friends and family wear. Those are the ones that you see in magazines and on commercials. So soft lenses are an option for very early keratoconus patients. There's also custom soft lenses that are specifically made for keratoconus, which we're going to go over in a little bit. There's also hybrid contact lenses where the lens is hard in the middle and then surrounded by a soft contact lens skirt. There's traditional gas permeable lenses, which are very effective at managing keratoconus. And then there's also scleral lenses. There's also surgical options. So cross-linking is something incredibly important. This was FDA approved in 2016, and it has become really the gold standard for keratoconus patients, especially kids. So if you're a parent of a child or you have keratoconus and you are in your teens or early 20s, I mean, even 30s, this is something that you should definitely ask your doctor about to see if you're a good candidate. Cross-linking is a very easy procedure and it's pretty non-invasive, honestly, and very, very safe and effective. So this is a wonderful treatment option that we have that's now available. And in fact, 96% of insurances will actually cover cross-linking. So if you're worried about the cost, a lot of times it can be covered for very little. There's also things like intacs or intrastromal rings. This is where we put a special ring into the eye to try to stabilize and center the cone. It's not as popular anymore, but that used to be a very popular treatment option 10 plus years ago. There's a really interesting study, I guess this is This was published very recently. But the whole purpose of this study was to try to figure out what is the economic burden of a keratoconus patient. How much are you going to have to spend, or the system having to spend, on managing the disease, the testing that you'll need, the contact lenses that you'll need, the surgical that you might need. And what this was showing was that with cross-linking, it really can help if you apply it earlier in the disease progression. I think that is so important. So again, if you're a younger patient, or you're a parent on this call, or a sibling or a family member of somebody that's got keratoconus that's really young, it's really, really important to look into cross-linking at an early stage to help prevent some of this debilitating vision loss. You could also do nothing. I do have some patients where they decide that they don't want to do contacts and they don't want to do surgery, despite our best efforts. It's not something I can force people to do, and other doctors can't force them to do it, but that's always your choice. So if you do nothing, you just need to be aware that this is a progressive condition. It does get worse over time, and by doing nothing, your vision is really just going to get worse and worse and worse, blurrier and blurrier, and that really, really affects your quality of life. This is a question that I think is the main crux of this evening, which is, what is the best treatment for keratoconus? So is surgery the best option? Are contact lenses the best option? What type of contact lenses are the best option? And I think that it's important to realize that this is going to be different for every patient. So the treatment option that's best for you at your age and at the severity of the keratoconus that you have, and what type of lifestyle you have, and the current financial situation, is going to be different than the next keratoconus patient. So no two keratoconus patients are the same. As your doctor, we are taking into consider all of these factors to recommend a treatment option that we feel is best for you. Some of the best resources that I love are actually from National Keratoconus Foundation. So the National Keratoconus Foundation has these great pamphlets and booklets that eye doctors can purchase and have in their office. And we can give these to patients so they can get a true understanding of what keratoconus is and kind of what that means, who's at risk in their family, and what are some of the best treatment options. There's also a site called Living with Keratoconus that's also produces some great quality information. There's some really great authors and speakers that are very well representative of keratoconus treatment. Many of them have been online with National Keratoconus Foundation, and they also see them as key opinion leaders, so check that out. And social media forums. Now, these are good and bad. So many of you may have joined up with some sort of keratoconus support group or media forum or something of that nature. So some of the good things about this: keratoconus is a rare eye disease, and a lot of patients, they're the only person that they know that have this disease. So you might be thinking to yourself, I'm the only person in my family that has this. I have no friends or any relatives or really anybody that I know that has it. So keratoconus can be, sometimes you can feel very lonely because nobody understands what you're going through and what your vision is like and some of the things that you have to deal with. So I do think these social media forums and some of these support groups have been excellent, because it's really provided a community of people that understand what you're going through. And I think that that is very reassuring and great to kind of bounce ideas off of each other. So this is, these are some of the absolutely great things about these forums and such. Now, something that I always want to tell patients about is you have to be very cautious on some of these forums, because again, remember my last slide that says we are taking into account so many different things: your age, what types of lenses you've worn, how thin your cornea is, how severe your keratoconus is, what you've tried in the past. I mean, we are taking into account so many different things to customize a treatment plan specifically for your specific condition. And sometimes I think that can get lost in translation when I know that other patients out there that have keratoconus, they're just trying to help each other. But somebody could say, well, you should really try this type of contact lens. And then that patient might think, well, my doctor has never said anything. I don't trust them anymore. But the thing is, that patient does not know all of the things that are going on with your specific case. So that is definitely something to consider. Another thing that sometimes I get questions on is, hey, this patient on this forum says that I should try this solution instead of this one. And there's been many times where it's actually not a good recommendation. Either it's not compatible with the lens type that my patient's in, or it's actually not compatible with any sort of gas permeable lens or scleral lens option at all. And so we have to be really, really careful on these forums because the person that is responding may just not know your entire situation, and some of the information out there could be a bit damaging. So these are some common questions. We won't go over all of these, but I know that the National Keratoconus Foundation does a great job on why do I get this? Is it hereditary? Am I going to go blind? And what if I don't do anything? Some of these questions I'm sure are answered on some of the other webinars. Something that is important, since we're going to be talking about all these different contact lenses, is you want to make sure that you're telling your doctor about your health. Tell them about not only your eye condition, but if there's any other health issues going on, because that will also help determine what type of lenses that you might be a good candidate for. Tell them about your job and your lifestyle. Maybe you have some hobbies. Maybe you are working on the computer 8 hours a day and you like hiking and you like swimming. Some of these things are really important to tell your doctor because that will kind of streamline what contact lens options you may and may not be a good candidate for. It's also important to tell your doctor what are the specific goals that you have. Sometimes my patients, they just want to be able to wear a lens during the times that they are active. They don't mind wearing glasses the rest of the time. Let's say they have mild keratoconus. Some patients want to be able to see far and up close. Some people want to be able to get rid of glare at nighttime, especially for night driving. So tell your doctor some of your vision goals, and that will also help them kind of curate a customized plan based off of your specific needs. Another thing I always ask my patients is, what have you tried in the past? So if you've already tried a contact lens and it didn't work, I will investigate why that didn't work. What were some of the things that you found challenging? Because the contact lenses are rapidly innovating, and ones that you may have tried 30 years ago maybe fit a lot differently. We may have better designs, better materials so that you could try those again. So these are all things that you should make sure to tell your doctor about. So after all of this, I think the main thing that I want to get the point across is that your eye doctor is the absolute best person to help you make a decision on what contact lens is best for you. Again, be very wary of recommendations from social media forums and some of these other chat things, because those patients, they just don't know your situation. They don't know where you're at in your disease. They don't know what you've tried in the past and just your lifestyle and the thickness or thinness of your cornea. I mean, all of these things play a role when your doctor's recommending a contact lens for you. So now we're going to get into the contact lens options. Dr. Chiu, are there any questions at all as far as the overall discussion with the doctor or some of the social media things? If not, then we can dive right into the different types of contacts.
So far you have been doing an excellent job, and I completely agree with everything you've said so far, really stressing the point that your doctor knows your eyes the best, your stage of keratoconus, and what's going to best work for you in your lifestyle and your career. So you touched upon some excellent points there. And there's actually a lot of questions about how to find doctors who know how to fit these specialty types of lenses for keratoconus. I just wanted to highlight that in the chat box, we have included the website link for nationalkeratoconus.org. There's a doctor locator for patients to find providers who are familiar with keratoconus. And I just wanted to also give another some resources. One is called the Scleral Lens Society, and I can type that link in the chat box as well. There's also another organization called GPLI, which is the Gas Permeable Lens Institute, and there is a list of providers on that website as well. So that answers that questions about finding doctors. And then some of the other questions I think you might get to in a little bit, but let's just start off with one here. One person has said, I just got scleral lenses and I have not worn them yet because they seemed really uncomfortable. They're hard to put on and hard to take off, and I have so much anxiety about breaking them in. So I know you might, I'm sure you're going to touch upon this, but do you want to kind of segue into that a bit?
Sure. So that's a great question and something that we deal with all the time. The best recommendation I would have is making sure that your doctor knows you're having this issue. So the worst thing that you can do is just try to deal with it on your own and not let your eye doctor know. The best thing you can do is call your doctor and say, I'm really having an issue getting the lenses in. I'm really having an issue getting them out. I'm really nervous about kind of breaking these in, or breaking the lens, or having it break in my eye, or whatever the other issues that you're having anxiety about. And with that, I think that it's always best to let the doctor know that you're having this issue. What I do is, if a patient calls and they're having that problem, we bring them right back in and we repeat training. It might just be as simple as the way that you're holding your eyelids, or it might be might benefit from a different type of device to insert the lens instead of just using the plunger. You know, there's a bunch of other devices that are available to patients. So whenever I hear that for a patient, we have them come right back in and we repeat training so we can find out what the issue is.
Excellent. One more here. I'm currently dealing with eye drops and extremely dry eyes and advanced keratoconus in both eyes, and currently cannot see out of my left eye. And I get a lot of goo under my scleral contact. Nothing seems to help. Any suggestions? So first of all, a lot of these questions we're getting in, we know that your eyes and your situation is unique. So we're going to try to, provide the best answer we can given what we know about you. But there are a lot of things that we throw out there: high drops, dry eye, advanced keratoconus, trouble with vision. What would you say to that, Dr. Wu?
Yeah, so again, I'm glad you brought that up, Dr. Chiu, because we're not here to diagnose or anything of that nature, because we don't know your specific case and your eye situation. But this is something that happens with many of my patients that have high drops. And unfortunately, a lot of times it just takes time for it to heal back up until the eye becomes more stable. Sometimes your eye doctor can adjust your medications as far as ointments and medicated drops to help with that. And they can sometimes even make some adjustments to the scleral lens to help with some of the mucus production. But unfortunately, with high drops, that is usually a case where it just takes some time and for it to kind of stabilize. And of course, Dr. Chiu, you're welcome to chime in as well.
Agreed. It can take from weeks to months for that cornea swelling, which presents as this big white kind of dense opacity on your cornea, to fully heal. So unfortunately, it takes patience and time. Like Dr. Wu said, sometimes medications can help expedite the healing, but it might be a couple of weeks or months before your cornea clears up again for you to be able to utilize your contact to get you the best vision possible. So
Absolutely.
With that, why don't we continue with your talk, and then we'll have some more time at the end for questions.
Great. Okay, so what we're going to do now is we're going to talk about the different types of contact lenses that keratoconus patients can wear. The first one is a soft contact lens. If you have very early keratoconus or it's detected very, very, very early on and it's very mild, you might be able to wear standard soft lenses. This is what I was talking about before. These are the contacts that you see in the magazines. These are the ones that you see as far as ads online and commercials. These are the ones that are very, very commercially available that your friends and family wear. So I do have some keratoconus patients that are very, very, very mild that are able to wear just regular soft lenses. This is very, very few and far between. I think out of the thousands and thousands of patients I have with keratoconus, there's probably only like 10 patients that I have that are able to wear regular soft lenses. So there's another type of soft contact lens, which is specifically designed for keratoconus. So there's a few different laboratories that make contacts, and they have their own designs that are specifically made for keratoconus patients. So there's lots of different lens options out there, depending on which ones your doctor likes. You know, I like certain ones. Dr. Chiu probably likes different ones. It's just probably the ones we were residency trained with. But these are all kind of having the same premise that they are still a soft contact lens, but they are custom designed specifically for keratoconus. Patients that have mild to moderate keratoconus will be able to wear lenses like this. As the eye gets more advanced and more severe with keratoconus, this will not be an option because it just won't correct all of the irregularity. So let's go through a case report. So I had a 33-year-old white female, and she was diagnosed with keratoconus in 2019. She did have the cross-linking surgery in her left eye in 2020, and her surgeon didn't think she needed to do it in the right eye for now. And she complains that she's got strained vision, double vision, and headaches. With her glasses, she sees 20/40, but she sees double in both eyes, right eye and left eye. So if we're taking 20/20 as the magic number, you're all used to hearing 20/20 is considered perfect vision with glasses or contacts. So in this particular patient, she can see 20/40 with her glasses. This is a picture of her topography. Your doctor may have shown you these photos of your own eye when you were diagnosed with keratoconus, but it's basically just showing you any areas that are red, are very steep, and those are the areas that we're going to focus on when we're fitting a contact lens. So her ophthalmologist that referred her to me really wanted her to be in scleral lenses because she had dry eye as well. But for some reason, when we fit her into these lenses and we tried making a lot of changes to the material of the lens, the filling solution, her care system, but she just had some constant dryness. We even added Restasis and a few other eye drops, and it really didn't have any effect. So after trying all these different changes, I thought, well, maybe she just has some sort of sensitivity or allergy to the gas permeable material that scleral lenses are made from. So then we fit her into a hybrid lens and then a soft lens. So what I did is I had her come back in and I put a hybrid lens in one eye and I put a keratoconus soft lens in the other eye, and I let her sit there for about 5 minutes, and I just asked her, you know, where are we at as far as comfort goes? And with the hybrid lens, she still said that she kind of wanted to rip that out of her eye. So this is the hybrid lens on her eye. So you can see in the center, there's like a ring and it's kind of moving around. That is the hard contact lens that's giving her good vision. And then it's surrounded by a soft contact lens skirt. So there is a hybrid lens option for keratoconus patients that maybe some of you guys even wear that are on this event. So she said she wanted to rip those out of her eyes. She thought that the soft contact lenses felt much better in her eye. So what she's wearing is something called the Kerasoft Thin. This is a particular soft lens that is designed for keratoconus, and it's a soft lens. And luckily, she was mild enough as far as her keratoconus goes to be able to wear something like this. It's a soft lens, it's designed for keratoconus, and she was doing much better with this type of lens. So good candidates include patients that have mild keratoconus, or in this case, patients that just cannot tolerate other lens designs. So you might be on this call and thinking, oh my gosh, like I can't get my scleral lens in. I've had patients where we've tried a million different devices and things, and they just still can't get their scleral lens in. In that case, we need to shift and try something else. So this might be something that patients are good candidates for. There's lots of different designs, so there's no one that's better than the other. Kerasoft Thin is just what I use during residency, so I'm very comfortable with the Kerasoft family. But there's also lots of other lenses like the Novacone, and there's a bunch of other custom soft lens designs that are specifically made for keratoconus. But so if this is something that you think you might be a candidate for, of course, you can always ask your doctor and see what they say. So I did want to just touch upon keratoconus lenses that for hybrids. There's something called the Ultra Health, and this is a specific lens that's made for keratoconus in that hybrid design. So as you can see in the picture on the right, the purple is the gas permeable lens, and then it's surrounded by a soft contact lens skirt. So I've had some patients, again, where they couldn't get a scleral lens in their eye, and they could not get it in or take it out, or whatever the issue is, and we had to switch them to a hybrid lens because it's smaller and it's a bit easier to insert. So this is also an option that many doctors fit. Now let's talk about corneal gas permeable lenses. Gas permeable lenses are actually one of the go-to types of contact lenses for keratoconus patients of all sorts. You can wear gas permeable lenses early on. You can wear them when you're moderate. You can wear them when you're severe and very, very advanced. So corneal gas permeable lenses were some of the most revolutionary contacts that first came to market for keratoconus. And so we fit them all the time. Good candidates are really anybody can wear this type of lens. And it is a lower cost option, especially compared to a hybrid lens and a scleral lens design. Corneal gas permeable lenses are much less expensive than those. So if you're somebody that loses lenses a lot, or you break lenses a lot, or you're really worried about the finance component, this can be a very, very good option. Some of the cons of gas permeable lenses is that they can be more uncomfortable than other lens types. So for me in particular, I remember getting fit into gas permeable lenses in optometry school, and it felt terrible. I had to get it out of my eye, and I was like, there's no way I can wear this thing. But some of my patients, I think that optometry students were just wimps, and it's probably because we are having to poke and prod at each other every single day when we're learning how to evaluate the health of the eye. So we're just big babies. So when I fit patients into corneal gas permeable lenses, I'm often surprised at how well they tolerate the lenses compared to myself. One of the other cons is they can pop out of your eye easily. So if you're in a situation where your keratoconus is very advanced, the edge could lift up a bit and it can pop out. And if you get any sort of like dust or dirt, or you work in like an environment where it's like windy or dusty and dirty, if you get a piece of any of that underneath the lens or into your eyeball, it feels so terrible. It's really uncomfortable. You have to take the lens out, rinse it off, rinse your eye, and then pop it back in. Another thing I want to mention is that it can lead to scar tissue, which is what we really, really, really want to avoid. All eye doctors that fit keratoconus patients, one of our main goals is to prevent scar tissue or limit the amount of scar tissue you develop. But if the lens is fit too flat, or let's say your keratoconus advances and you come back to your doctor 3 years later, well, now it's had time to kind of squish that part of the eye and can really lead to irreversible scar tissue. So here's another case report. Patient, she was a 34-year-old Black female who had keratoconus, had cross-linking done in both eyes in 2020. She uses some artificial tears, but she does complain of probably a lot of things that you guys complain of: light sensitivity, blurry vision, and double vision. And this is interesting. She's never used glasses or contacts, and she was 20/50 in the right eye and 2100 in the left eye. So her vision is actually quite blurry, but she just hasn't used anything. So this is her right eye topography. Again, you can see the red zone, so we know that she does have keratoconus. This is something called the Rose K. It's one of my favorite brands as far as keratoconus lenses. Again, I think it's because I use this lens on so many patients and I know the whole family of products really well from my residency. But we're using this type of lens to fit the patient. So you can see it's small, so it goes inside of that colored part of the eye. So when you see it on somebody's finger, it's like really, really tiny, and it goes into the eye, and the doctor will try many different lens designs until we find one that we feel fits your eye the best. So then I changed the lens a little bit because there was a little bit, it was a little bit too flat for this patient. And so this one is looking a bit better. So this is what your doctor will do. They will insert and remove several different lenses until they find the best shape for your eye. So with her prescription added in, she went from 20/50 and 2100 to 20/25. So awesome job as far as corneal gas permeable lenses are still very relevant and very, very important for keratoconus patients. So here's the last contact lens we'll talk about, which is a scleral lens. Probably a lot of you have heard of these or even wear them. One of the main reasons that we fit into scleral lenses for patients and doctors is because there's great comfort. Many doctors actually find scleral lenses easier to fit than other contact lens types, especially if your doctor has graduated within the last 10 years. If your doctor graduated before that, they were taught lots about some of the other designs we mentioned, whereas scleral lenses weren't really that popular. And but if your doctor's graduated within the last 10 years, I'm finding a lot of them are fitting scleral lenses easier than some of the other designs. If you are worried about the lens popping out or dislodging, scleral lenses can be a great option because the edges of the lens are tucked underneath the lids and lashes. If you work in that dusty, windy environment, or you hate getting things underneath your gas permeable lens, this is also a good option because it doesn't have that foreign body entrapment, meaning that piece of dust or dirt gets into your eye and underneath the lens and then scratches everything up and gets uncomfortable. Another benefit of scleral lenses is that we've got this liquid reservoir. So we've got this fluid layer that bathes the eye surface all day. So scleral lenses, not only are they great for keratoconus, but some of my patients that see me are fit into these that have incredibly complicated eye diseases that has led to a very irregular and very dry eye. And these have been life-changing for some of those patients. They've also given us the ability to fit incredibly irregular eyeballs. So if you have a corneal transplant or you have very, very severe keratoconus, some of the other lens options are very difficult to fit. And scleral lenses have really given us the ability to fit these complex cases. This is a great article that I always love referring to, but scleral lenses do reduce the need for corneal transplants in severe keratoconus. This is an article published back in 2018, so it's still very relevant and very, very exciting. Here's one of my patients that has a corneal transplant. He also has glaucoma and an irregular pupil, but a regular scleral lens sometimes cannot work for some of these patients that have very complicated conditions because it induces a bubble like this or other issues. So this is a patient of mine that we had to end up fitting him into a very, very custom contact lenses because a regular scleral lens would always have a bubble come in and it would be compressing on the glaucoma surgery area. So here's another patient. I have a 38-year-old Hispanic male referred by his ophthalmologist for contact lens consult in the left eye. He has keratoconus and he's worn corneal gas permeable lenses, but he's complained that they dislodge all the time and he's got discomfort with them. So the main purpose of him coming to see me was to see if there's any other options. The best vision in his eye is 20/80. And he does have a corneal scar. So you can see in this photo where his pupil is, the black part of his eye, there's some white haze kind of in that area, and that's on the cornea where the keratoconus is. And that's probably also what's leading to some of the decreased vision. So here's his topography. And again, we can see he definitely has that red spot. And in my practice, I use something called a scleral topographer. This is where I'm actually mapping the front surface of the eye in different gazes. And what this does is it stitches all this information together, and essentially it's creating like a 3D map for me so that I know what the surface of the eye is looking like. And this is what that final image looks like when it maps all of that images together, and it tells me areas that are really tall on the eye, which are represented in red, and areas that are really low on the eye, which are represented in blue. And as you can see, this patient has many different colors all over his eye, so he is definitely a good candidate for a scleral lens that's much more custom. So I fit him into a diagnostic lens, and when I added in that prescription, he went to 20/30. So remember, he was 20/80, and by just fitting him into a new lens, his vision did improve to 20/30. So this is his lens on the dispense. The alignment of the lens and the centration of the scleral lens looks great, and he really, really liked the comfort of this lens. So I know I wanted to save as much time as possible for questions, and I'd be happy to answer any questions on contact lenses for keratoconus.
Thank you, Dr. Wu, for that very comprehensive review of all the different types of contact lenses that are available today, ranging from soft to rigid to hybrid to scleral. I think you really covered it all. So we do have a lot of questions, and we're going to get through as many as we can in the next 18 minutes. So the first here, there are some questions about cornea transplants. So if a keratoconus patient has already had a transplant, what is the best type of contact for them? They're asking, is an RGP better? Is a scleral better? What are your thoughts on transplanted corneas?
Great. So without knowing your history and kind of where things are at, it's difficult to make a strong recommendation without physically seeing your eye and knowing your history. But I will say that it really depends on what has happened as far as the corneal transplant, what your current state is, and your doctor will likely check something called the endothelium of the cornea to make sure it's healthy enough for a scleral lens if that's the option that you go with. I have patients that have transplants that are in all sorts of different lenses. So I have patients that are in corneal GPs. I have patients in hybrid lenses. I have patients that are in scleral lenses. I mean, I've got patients in all sorts of different designs. I will say that if your transplant is very, very irregular and it's really, really, really hard to fit a corneal gas permeable lens or a hybrid lens, a scleral lens might be the best option, but your doctor would definitely just have to make sure it's safe enough to use. But again, I mean, you could be a candidate for many different types of lenses, and your eye doctor will definitely be the best one to recommend something for you.
I completely agree with that. And I do have to say that, I've had some patients in scleral lenses over their graft who have done well actually for many years, but later down the line developed some challenges with cornea swelling and oxygen issues, because as we know, the scleral lenses block more of the cornea and oxygen getting to the eye. So sometimes when that happens, I've had to switch patients into different types of lenses to account for what's happening in their eye. And in that case, an RGP might be helpful. So yes, many options for transplanted eyes. So let's talk a little bit about films. I've gotten several questions about white films and deposits, calcium deposits building up on both scleral and hybrid contacts. Can you speak to films and what to do about them?
Yeah, this is something that is incredibly common for many of my patients. So the film can be from so many different things. So again, having your doctor look at it when you go into the office, I think is the best thing to do, because they'll be able to look at the contact lens or your eye and just kind of see what is causing the film. It could be caused from your eyelids. Your eyelids actually produce liquid and oils and different things that get deposited onto the lens, and that could be part of it. It could be from eye drops that you use. Sometimes there's like a little bit of calcification or crystallization from eye drops that are used, and they kind of build up on the lens. It can be from proteins or mucus. I mean, a white film can be from so many different things. Again, there's lots of different things that have kind of come out as far as helping. So there's different coatings that can be added onto certain lenses called HydroPeg. That's something that I have found for a lot of my patients that has helped tremendously, is coating it into HydroPeg. And then they also have a system where patients can kind of recoat the lenses at home once a month or however often they need to. Also, sometimes changing the filling solution of your hybrid or scleral lens, if that's the lens type you're wearing. Sometimes changing the care system. Maybe you're using a certain type of care system that's not strong enough, or it doesn't break down the proteins or deposits enough, or maybe you're using something that's too mild. So these are all questions I think that are really great to ask your eye doctor, but some of those things kind of come to mind.
Thank you. And what do you think about ProGen? Do you ever recommend that for your patients?
I love ProGen. So ProGen is one of my favorite things for gas permeable lenses and scleral lenses. I recommend it all the time. The only caveat is if your lenses are coated with HydroPeg, so you have to ask your doctor about that, it will strip off that coating immediately. So, and you can't add it back on unless you have the doctor send the lenses back to the lab, and some labs don't accept lenses back in, just with all the COVID stuff. So ProGen's an excellent thing. I use it on lots of my patients. Sometimes patients will even drop off their lenses and we will do the treatment in office for them. It only takes about 30 minutes to do. But what it does is it just strips off basically everything, the proteins, the lipids, some of those really stubborn deposits. So that's an excellent product to use. But again, make sure you ask your eye doctor, because if your lenses are coated with HydroPeg, you won't want to use that because it's going to strip off that coating.
Absolutely. So this is a very practical question. You did touch upon costs, that one lens modality may cost more than others. RGPs are possibly more affordable. There's some questions about trouble with getting coverage for these lenses as medically necessary, and trouble with, insurances. This is obviously a challenging topic even for doctors who are fitting the lenses, but what would you say to the patients about insurances and coverage?
Oh, this is such a challenge and a headache for patients and doctors and all of their staff. It
Mm,
is, it's something that I have dealt with for many years. And it is frustrating because sometimes the insurance will not cover a certain type of lens and your doctor is recommending a certain one. And so it is unfortunate that some of these insurances, they will only cover a certain type, or they won't cover really anything at all. So it's an unfortunate situation. A lot of times I've had patients that are relentless in calling and trying to get like a case manager on their specific case that has worked. But I don't know how much time you have on your hands, but if you have a lot of time, this has worked for some of my patients, where they actually will keep calling and they'll keep calling until they find somebody that will take on their case and kind of be an advocate for them. But yeah, insurances are such a nightmare for really everybody involved. And that's really why I got out of insurance and with my new clinic, because I wanted to be able to prescribe the contact lens that I felt was the best for the patient and not having insurance dictate care. But it is unfortunate. We all feel your pain. I mean, we're all in it together as far as trying to do our best and try to write letters. And your doctor can write letters to the insurance companies explaining why you need this. Some other resources would be like, if you have a local Lions group or Rotary Club, that's how some of my patients were able to get some of these lenses funded. Sometimes when there's like workshops or things, you can sit as a patient for free, or if they're doing studies, these are all types of things where you can get some of these lenses at low or no cost. So those are just a few random ideas.
So I think what is important that we want our patients to know, and all of you here today, is that we as optometrists want you to get the lenses and best care that you need. We want to help you. But as we know, there's cost to the lenses, and the practices have to purchase these. And just so our attendees here know, insurances, even if they cover the lenses, sometimes it doesn't cover the actual cost of the lens and the time. So that's why it's difficult for some doctors to maybe take all of your insurances, and that might include one that you have. But there are some vision insurances that cover contacts for keratoconus patients. Some don't. Some medical insurances cover, some don't. But it's really, there's hundreds, maybe thousands of different plans, and it makes it really difficult to know. But just know that we as providers want you to get the best care possible, and that we really do as much as we can to try to help you. And some of the resources that you just mentioned are really helpful, Dr. Wu, for maybe some patients who don't have an insurance that their doctor takes, or that they just don't cover that particular lens. All right, so we have about 9 minutes left. Let's go to this question here. So when I have my scleral lenses on, my distance vision is great, but my close-up vision is horrible. I have to wear readers. Are there contacts for keratoconus that allow you to see both distance and near without readers?
Great question. The short answer is yes. Scleral lenses, we can either do something called monovision, where we make one eye for distance and one eye for close, or some options are multifocals, where the scleral lenses can be made where you can see far and up close kind of at the same time. However, that being said, I don't know what scleral lens you're in, because some of the labs have some limitations. So I don't know what the parameters are and what type of lens you'd be able, if they even have that as an option. Most labs do have a multifocal that's available nowadays. Some are better than others, and I think we are all still kind of in that experimental phase as practitioners, as far as finding out the best optics for these patients. And I'm finding that each patient is custom. Each person needs to have their optic zone for near and distance a bit customized, and some doctors are not comfortable taking that on. So for sure, ask your doctor and just tell them, like, hey, I love my scleral lenses and I can see great far away, but is there anything we can do for the up close besides using reading glasses? Those are two things that I can think of: monovision, where they can change the prescription of one eye, or incorporating a multifocal optic, if that is something that lab has the capability of.
So question for you, Dr. Wu, are you, obviously a huge percentage of your practice is keratoconus, and maybe many of them are in their 40s, 50s, and beyond, where they have this challenge of presbyopia. Are you fitting a lot of multifocal contacts, whether it's in a hybrid GP or scleral lens form, or are you doing more monovision, or are you doing glasses on top? Could you kind of share like what works best for you and your patients?
Yeah, so if it's a keratoconus patient that has a relatively healthy eye, so that means The back of the eye doesn't have a lot of problems. They don't have any sort of severe dry eye or glaucoma or macular degeneration. So if you're a keratoconus patient and really the rest of your eye is quite healthy, I have no problem trying a multifocal on that patient. So what I always do is I always get the distance vision in both eyes dialed in and the fit of the lenses dialed in perfectly or as most accurately as I can. Then once we've tried the lenses out, then you might have to wear reading glasses and things for doing your up close work. Then we can talk about adding on either monovision or a multifocal to the lens if you're a good candidate. So our practice, we have tons of patients that are wearing multifocals, but it also depends on if you're a good candidate and kind of what your expectations are. If you're somebody that wants crystal clear vision, far, intermediate, up close, without ever having to wear glasses on top, that is probably not going to work out. So if you're somebody that wants just something more functional because you just hate having to put glasses on all the time, you're just looking to reduce dependency, you might be a good candidate. But again, you'd have to have that conversation with your doctor.
All right, so we are going to close with kind of a question with maybe two more questions. So one is, what is your experience with fitting patients with higher order aberration correction, particularly in scleral lenses? And then the next one is, can a keratoconus person wear ortho-K lenses? So we're going to touch upon higher order aberrations and ortho-K.
So ortho-K is an easy one. No, that's not safe, and that's because you're putting too much pressure on the cone, and that will cause scar tissue. So keratoconus patients are not good candidates for orthokeratology, but I get this question all the time. And then the second question is higher order aberrations. We have technology in our office that does allow higher order aberration optics onto scleral lenses, but in my honest clinical observation, it's been 50-50. Some of my patients do excellent, some of them do terrible, some of them don't notice any difference at all. So again, this technology is so new that I think we're still in that kind of information gathering stage, where a lot of doctors around the US or the world are using this type of technology, and we're all sharing our experiences with each other. Oh, hey, somebody that has keratoconus that's this age and that has this problem is not a good candidate. Okay, these people I've noticed are really good candidates. So we're all, I think, in it together in these kind of beginning stages, but that has been my experience with my current patients so far.
Completely agreed. I think it's exciting because we have technology in these aberrometers that can detect these higher order aberrations. And we're, just like you said, really collaborating, doing research and learning how to best correct this vision. Now we have to remember, if the cornea is scarred and there's an opacity in the central cornea, there's only so much we can do about so much we can do, for correcting these higher order aberrations. But I think there's potential, and we have so many people working on this now that I'm hoping that a couple years down the line, we'll be able to make more of an impact. There's just so many factors with lighting, pupil size, glare, the shape of the cornea, that it makes it difficult. And it's interesting to hear your responses that it's kind of all over the page at this point. So maybe when we discuss this topic in a couple years, we'll have more to share. I think we have touched upon a lot of these questions. We have gone through so many different contact lens related topics, and I've learned from you, Dr. Wu. So thank you for your time, your slides, and just educating all of us tonight. I am sure that our attendees have learned a lot, and I know that this talk will be recorded and up for people to review again if they wanted to kind of review some of the topics or cases that you shared. You have put up your contact information here, and we wanted to just share about our next upcoming webinar, which is on the next slide on May 10th. The topic will be cross-linking for keratoconus, better with more bonds by Dr. Michael Greenwood and Dr. Brooke Messer. So we touched upon cross-linking today, and we will be going into it in much more detail in 2 months from now. So thank you everyone for your time and for joining us this evening. I'm Dr. Gloria Chiu from USC signing off, and thank you again, Dr. Stephanie Wu, for your time, and thank you for National Keratoconus Foundation for helping to put these webinars together. So have a great evening and a great day, everyone. Bye-bye.
Bye.